won't you let go? Let me tell you, friend, believe me when I say I know. It always feels like we're punching in. Well, I'm glad you stopped by. The fun is about to begin. You paid good money at the door and get ready for a real good show. If you want to have a real good time with me tonight, you gotta move like crazy, dancing in the pale moonlight. We can all get down, spin inside out, I'm telling you. If you really want to groove, you gotta make a move.
Kirk, we are back,
We are back in the studio. Yes, we are.
man, and this is probably going to be the last time me and you are together for a little bit.
Yeah, there's going to be a few episodes here where we're remote, where I'll be on the road. So
I think it's going to be good. We've got some equipment on order to
Yep.
make sure that we can provide the highest quality audio and video.
absolutely, absolutely.
Well, who do we got with us today, Kirk?
Well, we've got Dr. Greg Gordon with us today. He's going to share his interesting journey from physician and to physician entrepreneur, where he's wearing the two hats of being an entrepreneur and, well, actually an inventor and a physician, and kind of what motivated him to start to invent the things that he did and start the company that he started.
That sounds interesting to me, because I wonder, like, because there's different types of people, right? There's the entrepreneur people
Yep.
that take a whole bunch of risks,
Uh-huh.
and then there's the people that go get the job. And
Yep.
like,
Yep.
how is that in the doctor world?
Ah.
Does that spectrums on the opposite sides? Or
Well, I mean, I don't know. I mean, I'm going to guess radiologists are a little more conservative than surgeons. Maybe Dr. Gordon can comment on that.
Well, it's a boy, a lot of questions. Big thoughts, big, deep thoughts about life in general. Shall we go back to my childhood?
Let's go back to your childhood and understand your psyche and what made you want to become a doctor, and in particular, what made you want to become an interventional radiologist.
Stop hitting me, mommy. Oh, I'm sorry. Where did that go?
Whoa. Are we
No,
rated for that,
honestly,
Riley?
no, honestly, I don't. You know what? Boy, it's a lot of questions. I mean, I think I was always very creative.
Okay.
And I was, when I say creative, I always like to have fun and joke, and I liked the arts. I liked theater. I liked history. I liked a lot of fun things. I liked conversations. I liked relationships. And when I went to medicine, you had those in a very professional way, and there's really nice constructive stuff, and it was really wonderful in many ways. But it's quite a rigid profession. I mean, there are rules to follow.
Yep.
In many ways, so much like a military situation. You go to medical school, you go to residency, you go to fellowship, you get a job.
Mhm.
That entrepreneurship, that creativity aspect, it can be a little bit difficult. And one of the things that I found when I was training, I got into interventional radiology, which we've talked before, Kirk, but it's kind of like MacGyver on steroids.
Yeah.
And it was a lot of creativity, and it was really something that really sparked my ideas, my passions, and made me think about things. And that's really kind of just how I started going. But I still always wanted to be a doctor. I never really kind of fit the conservative mold. I guess you could ask all the different jobs I've been in. You know, I tend to speak my piece, to go a little different direction. And I've worked with a lot of different companies in the past over the first about 15, 20 years of my career. And after a while, I just decided to go off on my own. And there's more of a specific journey, but I've always I wanted to do something more than follow the rules and go from lieutenant to captain to colonel and go through the military type of regimen of being a doctor and doing, even though I'm very proud of my career and I love education, and I love learning, I wanted to do something more. After 20, 25 years, I was really getting burned down, and it was really still.
So
Boy, I changed a lot of things, didn't I, for you guys? Where do you want to start? Can we start with my mom again?
Yeah, let's start with your mom again. Now, so what made you think, why don't I invent some stuff? Or, talk us a little bit through, that kind of that, what inspired you to invent the devices that you did.
Well, there's really a huge personal element in this to me, kind of like everybody else. You got to bring your past with you. Don't let the past hold you up, and not letting the past prevent me from doing new things. But I carry a lot of things with me. So interestingly, I mean, we talked about this in the past, but I had a bunch of orthopedic issues when I was a kid. And when I was growing up, I was going to be a doctor. I didn't really have a lot of choices. My mom and dad, you're going to be some type of professional. And that I was good at math and science, so it was relatively easy. But that being said, I had a bunch of orthopedic issues. And then when I went to medical school, I had to have my hips replaced. So I wanted to be a surgeon, and I couldn't be a surgeon. And so that kind of that started my journey of trying to figure things out. I got into radiology because I loved Where's Waldo. I loved, Sherlock Holmes stuff. That was really cool. It was new technology. It was just really neat. And I didn't have to use too much physical exertion. But the problem is my love for surgery kept me in it. And I found out there's interventional radiology, which is doing surgeries. I don't know how much people know about intervention.
Yeah, well, why don't let's talk a little bit about it, because we have a wide listener base. We're not just exclusively like medical device folks. It's covers, our listeners.
But
cover
do people know MacGyver? Do you guys understand MacGyver?
I'm sure people get MacGyver. Well, maybe the younger listeners don't. But
I love MacGyver.
I mean, yeah.
Yeah.
MacGruber. Maybe they know MacGruber. Okay. But anyway, so no, I mean so interventional radiology is a specialty in medicine where we image patients, right? We get information instead of having labs and drawing their blood or tissue, like that's pathology. And radiology, it's information from imaging, but it's really just not x-rays anymore. You used to think of it in x-rays. Now it involves sound and magnetics, MRI, ultrasound. And it also involves nuclear medicine, injecting things into people, but it also now includes therapy and diagnosis. So we use those tools to be able to see inside people and do surgeries that used to be done in an open setting, much more minimally invasive. So it's kind of our version of laparoscopic surgery or surgery that's minimally invasive. And we just do that through usually x-ray tools, but we use ultrasound and some people use MRI. So it was really cool. It was a way of me cheating, so to speak, sneaking in the back door and becoming a surgeon without having to go through the 36 hours awake. And, even though I'll be honest with you, the radiology residency was a lot harder than I thought it would be, but it was a way into the surgery setting. So it's really the best of both worlds. I get to see, Where's Waldo? I get to become MacGyver, cut that catheter in half. Let's try to heat it up and see if we can reshape it. Now let's put it, does it fit? Does it fit? And that's really what it was like 20 years ago and 25 years ago. And I had some amazing mentors. And then when I came out, I started practicing. And once I started practicing, I loved it because I'm reading films and seeing patients and then treating them. I mean, it's like, the problem has been, though, is that we're jack of all trades. So we pick something up, we start it, but we steal it from somebody else's specialty. So naturally, those people in general know that area, that organ, that field better than we do, and they take it away. So about every 5 to 10 years, I'm reinventing myself.
Yeah, I think endovascular surgery has certainly evolved in the last couple of decades, and as you know even better than me. And there's always that constant, like, starts out surgical, and then and then interventional radiologists do it, and then some of the surgeons learned endovascular techniques, and
they take it back, right?
And they take it back, exactly. Yeah.
Right.
Yeah, I feel like in the beginning it was like, that'll never work, that endovascular stuff. And then when it's working, it's like, oh shoot, we better learn how to do that.
Exactly right, because it's who controls the patient. So I mean, so really that was basically it. And then when I came into the becoming an attending, a senior person, and a lot of the medical device people that try our new product, try this and try that, and I was really interested in stuff and how are you making things better and what we could do. And kind of putting that together and all that whole picture together, and then going into my fellowship in interventional radiology, where now I found out the first hips I had were bad and I have to redo my whole hips, and during my fellowship. I'm also left-handed, and for most people are right-handed. So the labs are all designed for right-handed people. So number one, I'm in really severe pain, wearing 30 pounds of lead. Number two, my coordination is less than usual, and I'm a less than normal athletic Jewish person. I mean, take that for what that's worth. But I didn't make too many high school teams. So it wasn't I was much better in the book part, right? I played good tennis and I was okay swimmer, but so from a coordination standpoint, it's really a little bit more difficult for that hand-eye coordination. And so again, it spurred all my passions, and kind of like after 15 years or so of working with other people and helping them out, I was naive enough. Was it stubborn enough? Cocky enough? Stupid
I think
enough?
they're all interrelated, but I don't know.
Yeah, ignorant enough to go out and do this myself. And I was lucky enough to meet a lot of nice, really cool mentors from the University of Nebraska and from UNIMED, and then and some people in Lincoln and kind of the Nebraska community. It was small, but it was pretty cool. I got to tell you, it was very nice. They kept me going. They kept me focused when I could have really gone off on a ditch.
Yeah, I feel like we all work to try to help each other here and to build the industry and you know, through supporting each other and doing whatever we can to help. So,
hey, Riley here. Thanks for listening to this episode of the Make a Move podcast. For more content, check us out on all major social media platforms and makeamovepodcast.com. Until next time, get off your butt and make a move.